Thanks everybody for joining us. If you haven't already, please go ahead and introduce yourself in the chat so we can all get to know each other. Okay, Hilda, you can go ahead and kick us off.
Well, good afternoon. So welcome to our Mobility and Economic Resilience and Substance Use Disorder Workshop Series sponsored by NATO. I have known the folks at NATO for decades now, and I'm delighted, Carrie, to be invited to just say a couple of words in the opening. Welcome to Kentucky. We at USDA Rural Development are always pleased to have our partners involved in helping make our community stronger. And of course, for rural Kentucky to be an even better place to call home. I'll look forward to also hearing from my colleague, Betty Ann Bryce, who worked with us at USDA and helped us launch our opioid efforts here in the Commonwealth of Kentucky. And we continue to lead the nation, Betty Ann, in transitional housing. So we like having Kentucky known in this very important endeavor in terms of our substance abuse folks and make up our communities and live there. And we want to support them in every way that we can. We are very, notice it was talking about mobility, and we just talk about farm to market roads. We know that in our rural communities, those farm to market roads are now really the information highway. That plays a very important role in terms of our folks who are going through recovery. We also know when we talk about transportation, having a way to get to the doctor or get to a job interview or get to a meeting that you're supposed to go to, all are so very important in this whole scheme of putting the underpinnings together to help folks who struggle with substance abuse disorders to become very involved and contributing members of our communities. And we all need leadership. All of our communities need our talents of our people. Our work ethic is great. So helping those folks get to the point that they can once again be a part of our rural communities is very important. And we're always glad to be a part of it. We at our rural development, and I know you have our wonderful area development district folks on with Whitney Chestnut. I worked with Whitney a few years ago, I think when she first started in some of her ad work, known Ben Hale for a number of years, the Big Sandy, and Michelle Allen at Kentucky River. So you've got some great individuals, Carrie, to be involved with and help you out your day. I'm sorry that I do have to jump off on another webinar, and this one happens to be, as you all may know, Governor Fletcher and his efforts of his group to again tackle many of the challenges in our substance abuse communities. And so I'm just here to welcome you to Kentucky, to tell you that we at USDA Rural Development, whether it's funding mobility opportunities for transportation from our local communities, we are always available to be helpful to you, to sit around the table with you in the area development districts and say, what role can RD play in helping you carry out your goals in your community? Many times folks might have thought that we were all about just sewer and water, but we have many more programs to help our local communities, and our partners of our ad districts are critically important. So I want to congratulate you all on hosting for NATO and with NATO in conjunction these efforts, and I look forward to hearing the end result of what is going to be happening in the future and more of them to come. So Carrie, with that, I'll turn it back over to you, I guess, and just say thanks for letting rural development be a part of today. And just know, even if you're brainstorming in your community, invite us to be there, to be a part of it. And if we can't help you directly, maybe we'll think of another way that we can, because we want to work with our partners to make our rural community stronger. So thank you all, and have a wonderful day today with your programming.
Thanks so much, Hilda. We're really pleased that you were able to join us for a few minutes today, because USDA is such a critical partner for rural communities across Kentucky and across the US, with all of the various different grant, loan, technical assistance programs, and other kinds of support. So thank you.
My pleasure.
So I'm Carrie Kissel with the National Association of Development Organizations, or NATO. And as we get going, I want to give a quick shout out and introduce the rest of the members of our team. We've been working locally with 3 area development districts to develop the agenda and the content and invite the speakers and the participants for today. In particular, that's Jessica Blankenship from the Cumberland Valley Ad, Eunice Holland from the Kentucky River Ad, and Joe Jacobs from Big Sandy Ad. And on our technical assistance team, attending today, we have Rachel Byerly and Austin Barrington, also from NATO, along with me. From the Western Transportation Institute, we have David Kack, Natalie Vilwalk-Whitty, and Carolyn Klauser. And from the National Rural Transit Assistance Program, we have Robin Phillips and Nellie Kubahiro. So if you need anything, please feel free to chat to any of us on the team throughout today. And please introduce yourselves in the chat if you haven't already, so we can get the chance to know each other. Several of you, most of you on the line today are from those counties in southeastern Kentucky that are served by these 3 area development districts. But there are others of you on the line that are from other parts of the country, and that is great. We are glad to have you here to hear information and to brainstorm along with us today too. So thanks for being here. Nellie, you can advance the slide. In the agenda today, we'll have a mix of presentations, panel discussion, and group discussion in breakout groups. And the content will focus on setting the stage for what substance use disorder is and what some federal resources for that are, as well as dive into mobility, how people get around and what opportunities there are to build mobility up. If you'll move on to the next slide, I'll start with just some quick context for the workshop name. When we talk about mobility, that's fairly self-descriptive, that we're mostly talking about how people get around, what those transportation options are. So, as Hilda mentioned, so really critically important to be able to move goods as well as move ideas through broadband and internet connectivity. But economic resilience is a little bit of a different framing. Oftentimes we talk about economic development, but we're talking about resilience here because that really means the ability to withstand or avoid or bounce back from an economic shock or disruption, such as a natural disaster or the loss of a major employer. It's a little bit broader understanding than how we normally talk about economic development, and places a lot of emphasis on rooting those economies locally through local ownership and control of economic assets and building off an array, a whole variety of existing assets. If you'll go to the next slide. Last winter, I had the opportunity to come down to London and meet with several of you that are here on the line and to hear what's going on in southeastern Kentucky in mobility. And one of the attendees at the meeting said transportation is at the heart of everything, just really critical to for people to have options to get around. And during that meeting, the attendees identified some of those strong regional assets. It's easy to come from a place of thinking about what we don't have and what we need in rural development, but it's so much more productive to identify what we have and build off from there. So folks in that meeting last winter really identified a lot of assets that already exist in southeastern Kentucky, which was wonderful to hear about and to see and for me to learn about back when I was able to travel and meet people in person. Next slide. And we'll move on to our invited speakers. Betty Ann Bryce will kick us off today. Betty Ann is the Special Advisor for Rural Affairs for the Office of National Drug Control Policy. Betty Ann really knows rural areas and issues well since she has served in several positions also within USDA Rural Development. So go ahead, Betty Ann.
Sure. Good afternoon, everyone. Thank you for the opportunity to sit in on the meeting. I am going to apologize in advance because I too, after my presentation, have to go to do another presentation. So this seems to be the day for that. So my job here is to really just walk you through one of the resources that we created to help rural communities think about how to tackle the substance use disorder crisis. And we're really proud to have been able to get these tools out and we hope that you find them useful in the work that you're doing. What I will say is everyone uses these tools in a different way, and I encourage you to find the way that is the most strategic for you. So essentially, the Rural Community Toolbox is really a combination of three products that we created. One was the toolbox, another was the community assessment tool, and one was the Rural Community Action Guide. And the toolbox itself is a clearinghouse for funding. Essentially, 16, well, now 17 different federal departments came together to put all the rural resources that can help you rebuild a community from the ground up in one place and help you tackle the substance use disorder crisis. So while you will have transportation information in here, you'll also have housing, economic development, mental health, technical assistance training. So I hopefully you see it as a one-stop shop. It is the kind of site where you don't check it once, you should be checking it again and again, because grants become active and inactive at any given time because of the number of federal partners that are involved in this work. It varies, and you just have to keep checking it. Next slide, please. Giving you a quick look at what you see when you go into the tool. Again, I like to think it's intuitive. I always say it's iPhone 1. So as we go through and we get feedback, we improve it. But you can look by funding type, you can look by topic, you can look by eligibility, you can look at what's new. And essentially, this gives you a walkthrough. When you click on it, this is what you see. And to the right, this is where you go. This is a clearinghouse. So at any given time, when you are ready to apply, you are going right to the site to fill out your applications. What we did was put it all together in one place so you don't have to go to 19 different websites or 19 different agencies. Next slide, please. And again, this is just another view here using eligible applicant. Next slide, please. And another view here when you are looking for treatment information or services. So I hope you see it. You'll notice two real categories, active or inactive. When a grant is active, it's active during the time that it's open, and it's inactive when it's closed. We like to encourage folks to say, just because it's inactive, it will become active at some point. Use that moment to become familiar with it, because as you know, federal agencies have different funding cycles. Rural development may be open for quite some time, but the Department of Justice grant cycle, for example, is 30 days. So if you wait until day one when it opens to get information, you will find yourself being very frustrated. What we've done with these pages is the webinars, old webinars are there, information is there that will help you get up to speed. So when a grant opens, you'll be ready to apply. And we always, this is updated daily. And if you're wondering who's the person behind it, I am. So even if you send an email to complain, it's gonna come to me. So there you go. Next slide, please. Another thing that I'm going to run through really quickly, but I gave you a number of slides so you can use it as you wish. Next slide is a community assessment tool. We developed this because we believe if you understand the data and what's going on in your communities, you'll actually make more efficient grant choices and efficient options. So we really think that this tool helps you really understand what's going on, gives you a framework for thinking about the issues holistically, and also gives you a framework for bringing in new partners and maybe new initiatives that you haven't thought about. Next slide, please. So I'm going to give you a really good nuts and bolts. This tool was created. This is the data that's in there. What's important for you to understand is that we didn't create any new data. What we did was translate the data so it reflects rural more clearly. So you're using the same data from CDC, Census Bureau, everything that's out there. We just kind of packaged it in a way that makes it a bit more rural user-friendly. Next slide, please. This is what you see when you come up. I like to give a close-up of this because it's probably harder to see so you understand. This is built over mortality data. It is up to date as the CDC is up to date. So that's the best I can give you. If there are frustrations about how up to date we are as up to date as the federal government is. The darker the color, the bigger the problem. Again, we try to keep it very simple. You can get information on all drugs related deaths or just prescription opioids if you care. What's really relevant for you to understand is that this is in 5-year tranches. This is not year by year breakdown. That is on purpose because we want you to see where the trends are and the impact of your work on the ground. And I'll get to that in a bit. You can toggle between counties. And if you are curious, urban is in there as well. But obviously I talk about rural because I'm paid to talk about rural, but I don't want to make my urban colleagues feel like I'm not supportive. Next slide, please. On the side panel, again, we created a tool that was a bit more holistic. We updated it recently. So broadband access was added. Everything that is kind of in a box was added recently. We wanted to make sure that you are getting information as quickly as possible in one place so that you can help. You can have some decisions, you can make some decisions and have some conversations. I won't go through all of this. If you're again wondering who's the person behind the email, I get these emails as well. So I encourage you, if you have specific questions, you can reach out to me. Next slide, please. What I'm going to take you through quickly is what I gave you was a close-up of the top and the side, so you'll understand as I run through this. When you open the tool, this is what you see. Remembering what I say, the darker the color, the greater the problem. Next slide, please, because it's easier in a close-up. When I talk about, and here I just use some states as an example, so using Michigan, you can see their variation over time when you're looking at deaths related to prescription opioids versus deaths related to all drugs across that cycle of 10 years. And again, this goes up to 2018, which is the latest CDC data. It'll automatically update in December or January when CDC drops its new data information. Usually that's around the time that they do it. Next slide, please. What I love about this tool is not just, it shows you change over time. So if you zero in on some of your counties, you'll notice this Steuben County in Indiana, over the first cycle, they had 13 deaths. Over the next cycle, they had 13. So they've been able to stay stable. Same with county in Nevada. So it can show you over that 10-year period what your movement is across the spectrum. And by the way, this should invite conversations. How are they able to stay so stable and what's going on there? Next slide, please. Then it'll also show you changes where mortality is going up. And you'll see that in Cass County, Minnesota, and also in Somerset County in Maine. You'll notice that there were sharp shifts over that 10-year period, going from not so high deaths to really rather they're trending up. That should also be indicative of some questions of what's going on in these communities that you're seeing this. Next slide, please. It also shows good news, so I don't want to say bad news, but if you look at certain counties who had a number of high death rates and they've gone down, when you see suppressed, you means that the number has gone below a significant number that they don't make public for privacy reasons. So usually it's under 10. So that's a significant change for this county in Mississippi. And you'll also see in Hilda's home, backyard, Pike County went from 142 deaths in the first 5-year period to 95. So they are trending down. What you will notice, however, is that if you look at Pike County, it is going to still be dark blue. But that doesn't mean, and that's important here, that doesn't mean changes aren't happening. It just means that obviously they're starting from a place that is harder hit than others. So again, this really just, I encourage you to take a look at that change over time, because we know a lot of money is going into these communities. Where you are seeing sharp trending up or down, it's worth diving into. Are there disconnections in your policies and your gaps? So you are doing what you need to do, but there may be some disconnections that are worth exploring. Next slide, please. I wanted to zero in on this because it's important. It's broadband access. It's in there, but it's easier for me to show it using one state as an example, and I used Indiana. So if you go into Indiana, you'll see that their broadband access rate is 92.9%. But you'll notice that counties are not even remotely close to that. Some of them are no. So you don't have to guess at the communities that maybe had struggled with pivoting to broadband, because in your backyard, this tells you where the challenges are in your community. Now, this was done before COVID. So, but this is interesting when we update it around and get new data points and put in there what it's going to tell us. But it's worth you looking at the broadband access piece. This data is coming from FCC, and we have also other data points for broadband access in here. And so we're very happy that this information is in here to at least give you a sense of where you're starting from. And again, as you're thinking about this, think about what I said about grants. Think about the communities that need broadband infrastructure, who should be going out for Reconnect America, rural, all the different FCC and rural initiatives out of USDA to help with broadband infrastructure if this is indeed an issue for you. Next slide, please. What is good about this data is that this all prints out in one page. So if you click on it, a county, you get this information. Next slide, please. And when you click on that, this is what you get. So basically all the information I just get, poverty, unemployment, everything is all printed out in one page that you can take to a meeting, that you can dispute. I don't agree with this, that's fine. You can figure out, you can use it as a talking point for what's going on in your community. We also added some new features. Next slide, please. Remember I mentioned earlier location. If you click on the behavioral health resources, you'll see information about access within your community. And at the bottom, you'll see the actual location. And these are all, we blew in the SAMHSA and HRSA data in here. So again, this is all federal resources, a bit like the toolbox. We put it all in one place so you can get the information that you need to make the decisions that you are trying to make every day. Next slide, please. The last thing I'll point to, because I knew Robin was going to be on this, and it gives her a moment to talk some more about this later because I can't stay with you. We did a rural community action guide. I won't go into the details of everything in there. I encourage you to explore it, but it's essentially a lot of really smart experts, including Robin, really dug in and wrote about how to solve a problem in rural areas and to give action steps, not just solve the problem, but how can you solve the problem? This section was I'm going to focus on the transportation section because it was written by my good friend Robin, and I know she'll go into details on it. All I'm going to show you and encourage you to go and look at this because it's relevant to, I'm sure, the discussions you're going to have today. Robin really did a good job of putting together some thoughts on how you can kind of bridge the transportation gap. And this is just an excerpt of some of the action steps that she suggested would be useful for rural communities to take. And we brought her in because we kept hearing that transportation was a problem everywhere that we went. And up until COVID, we were doing transportation workshops, which we're thinking about starting up again, but I don't think I have to because Carrie's doing a great job. So we'll just piggyback on her work. Next slide, please. I wanted to just focus on something I never get to do with Robin, which is this great map that she created on how do you find a ride. You can challenge her to walk you through it, but I think this is really important as you're thinking about where do I start from and where do I finish? And this gives you a good job of asking, following that information piece and getting to a point where you need to go. I need to talk to X versus Y. And the last slide I'll leave you with is some of the mobility options that she raised and flagged for us. And there are many of them, I mean, too numerous to mention here, but it's also a good starting point as we think about coming out of the pandemic, which one of these would make really good sense as pilot to invest in, and every rural community is different. So taking samples from these and making them your own in different ways is, I think, the story of this section. So my last slide is really my contact information. I went through this really quickly, but I gave you the page number to challenge you to read. It's only 3 pages, and I've given you a good snapshot of it. And I think it's worth looking at the transportation challenge. I know in this moment, broadband may have jumped over transportation as the biggest infrastructure problem. but at a certain point, transportation is going to take over again. So I appreciate you guys having this discussion so we can be a bit ahead of the curve coming out of the pandemic. So thank you for inviting me to join you today. And if you have questions now, I can maybe take one or two. If not, Robin, Carrie, everyone knows how to reach me. And again, if you want to complain about the toolbox, you know how to reach me too. It's under contact on the page. Thank you.
Betty Ann, before you go, we had a question from Natalie regarding broadband access. Essentially, she asked, is that reflective of more granular information or the information found at the FCC?
That is reflected of the FCC. So
Okay.
every resource that, and thanks for reminding me, because we're with the federal government and because I'm with the White House, all the resources that we pour into it comes from our federal partners. So everything data-wise on the tool is coming out of the Census Bureau, National Labor, and all our federal entities. We understand there's a love-hate relationship with the FCC data, but we still see it as a good starting point from which to have a conversation, and it's still quite reflective of the challenges we're seeing. When I was preparing for this, I've saw areas with 10% broadband connectivity. So I still think it's capturing some of what is out there, if not at the level that we would like it to be. And also in the tool, you won't find any private partners, anything. It's all federal because we wanted you to have a clean site to federal data information.
Okay. And the only other question was, what is the lag time of the DC data?
The CDC updates on a yearly basis, usually between December and January. And so the next update will happen in December. Please know that we are already aware, just from where I sit, that mortality is up. We are trending up. We've seen more overdose deaths across the United States, across all rural areas. So the progress that we have made on this issue has been affected by COVID, unfortunately. So you'll see that in print soon, but I think you're already seeing that in your communities as well.
Yeah, thanks so much for being with us, Betty Ann. If we get any more questions, we'll send those to you. And we'll turn now to Mashana Jacobs, the director of the Mountain Regional Prevention Center, where she leads alcohol, tobacco, and other drug abuse prevention services for the easternmost 5-county region of the state, including Pike County, which Betty Ann had mentioned.
Okay, hello everyone. Thank you very much for having me here. I'm very fond of ads. I started out as a public administration specialist with an ad. So that was right after graduate school. And so it's great to see how everything comes in full circle and you end up back working. All life experiences seem to take you where you're supposed to be. I am the director of the Mountain Regional Prevention Center, and we cover Floyd, Johnson, Martin, Magoffin, and Pike counties here in Kentucky. Those of you with area development districts, there is a regional prevention center in your region. So I have a counterpart throughout the state in every region. There is someone that has my role. So that is a great resource for you all to reach out to. Many of the things that we do through the Prevention Center is we do a lot of collaborating with different community partners. We do a lot of technical assistance when it comes to substance abuse prevention and intervention. A lot of us are parts of what are the Kentucky ASAP boards. And if you're not familiar with those, they are Kentucky Agency for Substance Abuse Policy. And most counties have those. I know that in our region, they're usually through the county. We have two counties, like we have a Floyd Pike board. They are the two counties combined. We have the Johnson Martin Board, and that is 2 counties combined, and then McGoffin has their own board. So they are a wonderful resource. They're always looking for people with like transportation and things like that, because it's what we do is we work with the communities to see what is needed, how we can build capacity and things like that. So it's very important that people be involved in these boards. Mental health and substance use disorders is something that is very, we are seeing a lot of, unfortunately. When people say that with prevention, a lot of times I'll hear people say, oh, well, that doesn't pertain to me, that doesn't. Well, guess what? It affects all of us. It affects everything from jobs to health insurance. I mean, you name it, it affects it. So with the prevention centers, a lot of the things that we can do is we can offer specific classes, we can do trainings, we can do all these different things. A couple of the things that we are responsible for is if someone is charged with an under 21 DUI and convicted, prevention center staff is who actually does the assessment and then determines the programming that they do. Typically it's classes, or if they need more intensive. We do all different kinds of things. Mental health first aid, you're probably hearing, I don't know how many of you all have heard this nationwide. They're trying to do a big bump of mental health first aid, and it is a program that is based to break the stigma so that it encourages people to actually receive services if they have any type of mental health illness or disorder, or even with substance use disorder. So there's a lot of different things that we can offer as far as that goes. I've been in prevention since '09, and I have been the director here since for the last 3.5 years. So this is something that I love to do. It's a personal thing for me that I just always wanted to make a difference in people's lives, and I'm hoping that every day I may not get to see that difference right then, but I know that down the line, the statistics are going to show that we are making a difference. With looking at behavioral health, I have been in the last 2 weeks. With prevention, we do the strategic prevention framework, which we call is the SPIF. And the steps in it is assessing, I lost my train of thought, assessing, building capacity, implementing, evaluating. And so when she was talking about all this assessing, I was like, yes, that's what we've been talking about. But let's look at behavioral health. And the definition of behavioral health is a state of mental, emotional being and or choices and actions that affect wellness. So many times when people talk about behavioral health, mental health, physical health, they want to silo it. And the important thing to remember is that mental health and physical health go hand in hand. If you are not well, if you are not physically healthy, then you could not be mentally healthy, and vice versa, because they both have effects on the other. With prevention, we take the medical continuum of care. This is SAMHSA's thing of it, and we start everything from promotion to prevention to treatment and then to recovery. And we'll get into a little bit more of that in just a little bit. But with people think that with treatment you get into treatment and then you don't have it anymore, but you have the recovery period. And recovery is lifelong. So some of the impacts of mental illness that we have are, and the reason that I'm talking about this is because they go hand in hand. Everything can be mild to severe. I just wanted to give you some numbers, like in any given year, 18% of adults suffer an anxiety disorder, some type of anxiety disorder. 6.8%, they have a major depressive disorder. Substance use disorders, 8.1%. Bipolar disorder, 2.8. Eating disorders, 5 to 10%. And then schizophrenia is 0.3 to 0.7. And so any mental disorder is about 18.5%. Well, one of the things that we have to realize as a country, nation, area is that these percentages is only out of 40%, because only 40% of people with a mental illness actually receive services at any given time. So when you're looking at these percentages, you're looking at just the percentage of just 40% of the people. And like I said, it can be anything from mild, moderate to severe. Sometimes things come and go, and then sometimes they can continue and gradually get worse. Looking at substance use disorders, one of the things that I think is very interesting when it does come to substance use disorders, when I do prevention work, go out and talk to parents and stuff, they a lot of times don't want to come by my table because they say, oh, my child doesn't need that. That's not my child. My child doesn't do that. Well, I'm going to tell you, I do prevention, and that is one thing that I learned in prevention. You never say my child will not, because you never know. All we can do is teach. But one of the things with substance use disorders, one of the numbers that I said earlier with in any given year, 8.1% of adults have a substance use disorder. That is reported in the last year. That would be like the last 12 months. If you look over a lifetime, that actually shoots up to 14%. So when these numbers, and I've gotten all of this from where we do mental health first aid, they keep us as up to date, because as you all know, with research, you do the research, and it takes a little bit for everybody to evaluate it and things. So, and one of the things too with these is you've got the comorbidity. Actually, let me go back to understanding the disorder. So one of the, we already talked about in any given year, and the population over 12. So I just have a question. Does anybody know what one of the average onsets that kids actually start to use substances?
Is it like 10 or 11?
Yeah. When I started in prevention years ago, it was 12. And now it's down to around 9, 10 years old. So it's very important that drug education and stuff like that, prevention work, be done earlier, increasing risk and protective factors. 75% of people who develop a substance use disorder do so by age 27. Alcohol use disorders are almost 3 times as common as other drug disorders. And one of the things here, when it talks about the median age of substance use disorder onset is 20. Well, that's the median age. So that means there's a lot younger and there's a lot older. So, and of course, in history or in past, substance use disorders are more than twice as common in males than as females. But one of the things that we are noticing is we are seeing that actually we're seeing more females use substances now. You know, with COVID, things like that, we're seeing a lot of trends where like alcohol sales have gone, I mean, they've gone, some companies have reported like a 200% increase during COVID of alcohol sales. So for us as prevention, that's a little bit alarming because of, you know, what's developing right now while everything is going on. And a lot of times people will self-medicate, like with this. people, like if they have a co-occurring disorder or something like a mood disorder and alcohol or self-medication or whatever, instead of seeking treatment, they will just self-medicate. So that can be an issue as well. So let's, I've got a couple of notes here. One of the things that as many of you know, that of course it's very widespread, substance use disorders now. One of the things that that people do not understand is they say that, you know, it will never be me, it will never be me. 2 years ago, there was a study that came out that said 1 in 5 people that use pain medication for 10 days or more, 1 year later, they will still be on that pain medicine. So one of the things that I try to tell people is, you know, I hate to put it this way, but it's almost like we are all an accident or a surgery or something away, because, you know, people don't set out to have these substance use disorders. It impacts everyone. It impacts the families. It impacts our region. You know, it takes up a lot of our financial resources for when you look at, if anybody ever has time, go see how much money is spent in the state. You can look at all the different states and see how much is spent on medical expenses due to a substance caused accident or illness. It's a little bit alarming. But, you know, understanding that it affects all of us. With treatment, there are several types of treatment that people can get. Some of those include detox, which is a hospital stay for a while. And then a lot of times people after detox will then go on to an inpatient residential. You've got outpatient, you've got medical assisted treatments, which we're seeing a lot of use or a lot of success with that now. Recovery is a process, and it is something that, you know, is ever changing. You know, people are, it's something that when someone is in recovery, they are dealing with this every day. So, you know, it's something that it does not, when you do treatment, it just does not just stop. There's a process. Barriers to treatment and recovery. This is both with mental health, substance use disorders. There is big stigma related to it. People either don't want to admit it, or they think that it's saying that they're weak, or, you know, there's different reasons. And one of the things that we do, an activity that we do with our mental health first aid, is list a bunch of adjectives to describe someone that is has a mental health disorder or a substance use disorder, and a lot of times they're negative. So, you know, we're trying to change that to break the stigma so that people will get help. Lack of resources. There are so many resources out there now that when it comes to lack of resources, I think one of the biggest things that we see as far as treatment and recovery is transportation. And, you know, that's why we're here. Being in a rural area, you know, you can't just get on a bus system or call up an Uber or, you know, different things. So people getting to treatment, to groups, to support groups if they're in support groups, that type thing. And the lack of knowledge of the resources. The state of Kentucky has so many resources out there that, you know, we have the Get Help line now, the Kentucky Help, to where it goes into the main call center and it can get you in contact with treatment like very, very quickly instead of having to wait. And a lot of times just acknowledging that there's all kinds of stuff out there that we don't know about. So, but looking at the barriers, you've got the stigma to treatment, and okay. So for recovery, in our to make a successful or a recovery ecosystem to help build up the community, one of the things that we need to do is identify and share knowledge of existing resources. Look at our risk and protective factors. Use our communities. Use the people in our communities. You know, changing the social norm of what is going on in communities, building up the resiliency. I know that was one of the things that she was talking about right before me. And, you know, resiliency, the social support, you know, the strengths, just putting people into contact with that can make a huge difference in someone's life, and just being supportive. Identify the gaps and how to address those gaps. You know, what kind of gaps do we have for people getting treatment and to get them into recovery? So what are those gaps there? How do we address those? So I want to thank you all. I just wanted to give you a little bit of just information of what we do, what's here. Like I said, in Kentucky, there's an RPC everywhere. We're involved with treatment people. We're involved all around. We're sort of like the middle. And those of you that are from out of state, there are certified prevention specialists all over the country. When you are a certified prevention specialist, you're certified throughout the nation as well. So when we get our certifications, we're there as well. So you all have got people there as well. Here's my email. If anyone would have any questions, any comments, would be happy to answer anything I can. But thank you all very much.
Thanks so much, Mashana. That was a really great overview. I feel like the more I learn about substance use disorders, the more I realize I don't know, even with having several folks in my extended family that have gone through a lot of experiences. I feel like I'm just learning all the time what it means and how we can be supportive. So if anybody has any questions for Mashana, please put those into the chat. There was a little discussion while Mashana was talking about what transportation means after Mashana encouraged attendees to get involved with those regional prevention centers and to connect regional prevention centers with transportation, and some good conversation about transportation across all modes, including transit and walking and bicycling, that all of that is interconnected. So thank you for that, Mashana. Moving on in our agenda, our next presentation is going to be from Marianne Stock. Marianne serves as the Chief of Rural and Targeted Programs for the Federal Transit Administration in Washington, D.C. And previously, she worked in the industry for a transit agency in New Jersey. Go ahead, Marianne.
Thank you. That was very good. And it's a good segue talking about resources. The conversation that you mentioned in the chat going on is a great segue to what I'm going to talk about, which are resources for rural transportation. So you can go to the next slide. And I'm just going to give you a quick little overview of what I'm going to talk about in the next few minutes. I'm going to talk about the DOT Routes Initiative. That is a really nice resource. Some resources that were developed under the rubric that we work under the Coordinating Council on Access and Mobility, and I'll talk about that briefly. Then I'm going to tell you about some of our Federal Transit Administration Technical Assistance Centers that are great resources for learning more about how you can use transportation and to serve your community better. And then finally, I'm just going to give you some examples of some grants that we have funded under a CCAM pilot program, so you can understand the kind of grants that we do. So first, to start off with the Roots RU, it's a great acronym, Rural Opportunities to Use Transportation for Economic Success, or Roots. And what this is really, well, it was an initiative done at the whole DOT level. I work for the Federal Transit Administration. We focus on public transit, but we're only one mode among many. And this resource is really goes all across the department. And it was created to address some disparities in rural transportation infrastructure and make DOT resources really helpful to rural communities. And the resources that are there include a really nice applicant toolkit for competitive funding programs. So it is designed for all levels of grant application experience and really tries to enhance access to the US DOT grant opportunities for rural transportation projects. So it tells you what you need to do to participate in a DOT competitive grant process. It catalogs all the DOT competitive grant programs by applicant type and eligible project activities. And it just has a lot of good resources for to make applicants more successful in applying to DOT competitive grants. That one focuses on competitive programs, but also included under the Roots rubric is an overview of funding and financing that introduces all the potential funding. So also in Roots is an overview of funding and financing that talks about the entire variety of potential funding and financing options available at the DOT, including competitive grants, formula grants, loan financing, and public-private partnerships. And there's a lot of other helpful information. I have the URL listed there. And at the end of my presentation actually is all of the different web links that I'm going to talk about are going to be on a page at the very end of the presentation. So you'll have all that. Go on to the next slide. Okay. So before I go into the next set of resources, and there are a few of them, I just wanted to briefly take a moment and explain what the Coordinating Council on Access and Mobility, or CCAM, is, because I'm going to be referring to it on the next couple of slides. So it was established in 2004 by executive order to improve federal transportation coordination. And the CCAM is charged with improving the availability, accessibility, and efficiency of transportation for three populations that are underserved generally by transportation. And those you can see on the slide: individuals with disabilities, older adults, and individuals of low income. The Secretary of Transportation chairs the CCAM, and there are 10 additional agency leaders that form the rest of the membership. 9 of those 11 CCAM agencies currently can fund grant programs that can fund human services transportation. And we're going to get into a resource where you can learn more about that in a minute. And then the other 2, which are the Social Security Administration and National Council on Disability, don't fund grant programs, but they can fund, they don't fund grant programs, but they bring us a lot of expertise that enhance the CCAM's ability to serve its targeted populations. And so over the past couple of years, or several years, CCAM agencies have worked together with the FTA to create a number of resources that are really helpful to all grantees in rural areas. So those are the ones that I'm going to talk about next. Next slide. So the first thing that I want to talk about is our CCAM program inventory. In 2018, we conducted a series of focus groups with local and state grantee stakeholders. And what we found was that the #1 barrier to coordinating transportation was a lack of knowledge about federal programs that can fund transportation. So the CCAM program inventory was our response to that. And in total, we were able to identify 130 federal programs that can fund human services transportation for the 3 targeted populations that I mentioned earlier. And the CCAM program inventory is a searchable resource that provides detailed program information. It gives you, for these 130 programs, CFDA numbers, statutory references, information on who can be the recipients and the beneficiaries, and eligible transportation activities. And we have both a Microsoft Excel and a PDF version of this inventory on the CCAM website, which I'll have the link later on in the program, in the slideshow. So move on. So just to give you these are just a couple of the 130 federal programs that allow at least some of their program funds to be spent on human services transportation. What I should note is that for most of these programs, transportation is only an allowable expense if it supports the program's main goal. So, for example, transportation to take people to medical appointments, if it's a medical goal of the program, employment opportunities or training or education. All of these programs, for every program, we have detailed information in the program inventory, again, including what are the allowable transportation expenses, what's the focus of the program, primary population served, and lots of other things about each of these programs. So we hope that that's a handy way to find out more about where you can get funding for transportation. Okay, can move right along. The Federal Fund Braiding Guide is another one of our resources that the CCAM produced. We developed this resource because state and local stakeholders told us that they were not always sure when federal fund braiding was legally permissible. And we thought that an additional guide on that subject would be helpful. And what it does is it defines, we define federal fund braiding for local match and program eligibility to enable federal agencies and grant recipients to more effectively manage their federal funds and coordinate human services transportation. And when I talk about federal fund braiding, what I mean is that happens when federal funds from one grant program are used to fulfill the local match requirement of another federal grant. And in order for that to occur, the authorizing statute of at least one of the two participating programs, either the one whose match requirement is being met with federal funds or the program whose funds are fulfilling expressly authorize that federal fund braiding is allowable. And I wanted to give the example as shown on the slide here. So using this graphic, let's say there's a grantee that's providing transportation service to people with disabilities, excuse me, uses funds received from the Administration for Community Living Center for Independent Living program. And that would be the green portion of the graphic. And they use that funding to fulfill the match requirement on FTA's Section 5310 Enhanced Mobility for Seniors and Individuals with Disabilities program, which is represented by the blue portion of the bus there. And this the result of this is a joint project that provides transportation service for older adults and individuals with disabilities, including the Centers for Independent Living beneficiaries. So that sort of gives you just a little overview of what federal fund braiding is. Next slide. So this is the CCAM cost sharing policy statement. It's just another resource that appears on our website. And the FTA and the DOT work together with the Department of Health and Human Services and the Department of Veterans Affairs to develop the cost sharing policy statement. And later it was adopted or endorsed by all 11 of the CCAM agencies. So it's been agreed upon that these are principles that can apply to any transportation cost allocation agreement that uses federal funds from many of those 11 agencies. And it provides information about two types of cost sharing arrangements. Vehicle and ride sharing is one type, and the federal fund braiding that I was talking about earlier is the other type. It contains broad information that can be useful for any grantee that's interested in transportation cost sharing, as well as information that's very specific to a few of the agencies. The specific information contained there pertains to vehicle and ride sharing information that's specific to Centers for Medicare and Medicaid Services and the VA. And there are also general principles developed from DOT resources. So it's, again, publicly available, and we hope that it's helpful. Next, so FTA also funds a number of technical assistance centers that provide a wide range of services that some of you may be familiar with. Robin Phillips is on the line here from National RTAP, and I think we're being maybe co-sponsored or hosted by National RTAP today. They provide training and technical assistance specifically to try to meet the needs of rural and tribal transit operators around the nation, but we also have the National Aging and Disability Transportation Center that works to promote the availability and accessibility of transportation options that serve the needs of people with disabilities, seniors, and caregivers, focusing particularly on FTA's Enhanced Mobility of Seniors and Individuals with Disabilities program. And then the National Center for Mobility Management is funded through a cooperative agreement with the FTA and works to help communities adopt transportation strategies and mobility options that empower people to live independently and advance health, vitality, and self-sufficiency. So next slide. So I just wanted to take a really quick minute to show you the CCAM, excuse me, pilot program, which was an FTA grant program that there has been a series of starting in 2016 all the way through 2020. And there will be another one in the future. So stay tuned if this is something that interests you and you feel like you might have a project that might be eligible. So it was created to emphasize the importance of partnerships between health and transportation providers. The funding has to be used for capital projects to improve the coordination of non-emergency medical transportation for transportation disadvantaged populations. And it's funded more than 30 state and regional pilot projects totaling over $18 million since 2016. And it's really a demonstration program that supports all of the CCAM work that we've been doing with all 11 agencies. Next slide. So just to give a quick overview of what regions and states have received a CCAM pilot program grant, you can see that they really run the gamut all over the United States. And I'll just highlight a few quick examples so you can understand the types of things that have been funded under this program. So in Flint, Michigan, the Flint Mass Transportation Authority received over $500,000 to expand its same-day on-demand transportation with new partner agencies and clients, specifically veterans and individuals with substance use disorders living in Flint and Genesee County's rural communities who have to travel really long distances to healthcare facilities. Another example in Maine, they received $187,000 for a pilot project to expand on-demand bus service in rural northern Maine. That project is utilizing enhanced technology to fill gaps in service and improve access and mobility for older adults and individuals with disabilities. And in North Carolina, they got $280,000 for trip scheduling software to create a more efficient point of entry to connect under substance abuse treatment with transportation services in rural Northeast North Carolina. So those are just a few examples of what's been funded in the past. I think that sometime in 2021, there'll probably be a notice of funding opportunity for similar projects under this program. Here are the links to everything that I have mentioned, specific links. And there's a whole CCAM page that includes all of these resources, but what's on here are the specific links to the products that I mentioned. And then I have a link to Roots also. So with that, I'll take a few questions if you have any, or otherwise I will.
Marian, we actually are running a little late on time. So and I know you had some other things you needed to do today. We'll forward any questions that we get to you. I don't see anything that's come into the chat so far.
Okay.
So we'll make sure that we post all of these resources, all of the PowerPoints and all the information on the workshop website so that attendees can get them, and we'll email that out. And also we'll forward questions to Marian, or if there are some of the previous speakers that people think of questions for them later, we'll make sure that those get to you. Thank you so much.
Thanks for having me. I'm gonna take off.
Yep, thank you. So now I'm going to turn things over to Robin Phillips to moderate our next panel. Robin serves as the Executive Director of the National Rural Transit Assistance Program, which is, as Marianne mentioned, a Federal Transit Administration funded technical assistance center that's focused specifically on rural transit.
Well, I hope that we're able to find out more about what's going on with rural mobility in Eastern Kentucky from the people on our panel today. I would like, actually what would be great, because we do have our time, is for each person that I ask to just introduce themselves and say where they work and what is the name of their program and what types of service they provide within their service area. So the first person I have is Lisa Combs.
I'm the Transportation Director for LKLP Community Action Council. We are located in Hazard, Kentucky. We're the state broker for 3 regions for non-emergency medical transportation. We also provide public transportation in Leslie, Knott, Letcher, and Perry counties. I have Ori Smith with me. He's our Director of Public Transportation, and I think he has a little bit of information that he wants to hand out to people.
Sure. Thanks, Lisa.
Hey, Ms. Robin, we offer a variety of different trips to all aspects of clients. I'm still learning a lot of these myself. I haven't been here, but since July, we offer the JARC program to our workers and our college students. The public trips, of course, is pretty obvious. So basically about anybody can get them. We've recently entered into some pilot programs with the Department of Corrections, which goes along with our drug section today. We also work with Operation Unite to provide clients to trips to rehab. We work with their local drug courts on the public side to provide transportation for their clients to court and to rehab and so on and so forth. We try to keep our costs as low as possible to these clients as well.
Mm-hmm. Super. Is Joyce on today? Joyce Hinkle?
Hi.
Hi,
Yes, I'm here.
Joyce.
I'm here.
You want to talk about your program and the service area and the types of service you provide?
Yes, I do. Thank you. Sandy Valley Transportation Services was established in 1990 as a demand response transit agency, providing door-to-door services to the people in Johnson, Floyd, Pike, Martin, and Magoffin counties, with focusing basically on the elderly and people with mental and physical disabilities. In 1998, Sandy Valley was chosen to operate as a pilot program to become the first Medicaid broker in the state of Kentucky. The program was very successful, and therefore several transit agencies have now become brokers throughout the state of Kentucky. Sandy Valley provides transit services for several human and health service agencies and organizations and programs including Vocational Rehab Department, Department of the Blind, Drug and Alcohol Treatment Facilities, Mental Health Services, Pike Physical Court, Disability Determinations. We also have a dial-a-ride program as well as educational sites taking people back and forth to work daily, and provide transportation to public housing. Also, the Reach Kentucky initiative by working closely with the Big Sandy Healthcare in Floyd County. Also, we work closely with Centers for Independent Living to meet their transportation needs. And recently, like LKLP has stated, we were chosen to provide transportation to the Department of Corrections, providing them transportation to jobs, interviews, parole officers, and providing transportations to perhaps airports, Greyhound bus stations to get them back home once paroled. You know, there's always a need of transportation, but I feel that we do a wonderful job, and our staff and drivers do a wonderful job also. Thank you.
Thanks. Thank you very much, Joyce. And then Mona Whitaker. Are you?
Yes.
Thanks.
Hi, Mona Whitaker. I'm with Daniel Boone Community Action. We operate Daniel Boone Transit. We started the service in 1986. We do a lot of the services that Joyce mentioned. I'll make it quick. I'll try to get through this quickly. We serve Clay, Jackson, Lee, Owsley, and Wolfe counties. Our service area is rural. We do demand response transportation, and our folks just call in to our call center and schedule their calls. They can also visit our website or go through our info line. We do, last year in 2019, we did we drove over 2 million miles, and we made 162,000 trips. We operate completely demand response. We do mostly a lot of Medicaid trips. We contract with LKLP, they're our broker. And I'm sorry if you're having a little trouble hearing me. Let's see, and we also do a lot of inner city trips. We connect folks in larger cities. That pretty much covers most of what we do, but it's just public transit.
Okay, no, this is great. When we get done, I wanted to come back through and ask you guys each a question, or ask you all a question. Ann Weber, the mobility manager from the Rural Transit Enterprises.
Well, Ann is unfortunately not here, but I'm Michael Dixon. I'm the operations manager here at RTEC.
Right on.
To piggyback on Joyce and Mona, you know, we started in 1990. We started as one county. Now we operate out of 15 counties. We operate out of Rockcastle, Laurel, Bell, Knox, Whitley, Pulaski, Wayne, McQuarrie, Adair, Taylor, Clinton, Russell, Cumberland. We are public transportation. We do medical trips to medical appointments, shopping, employment, and intercity. And as well as we take our veterans to their medical facilities. We roughly do about 50,000 trips per month. Of course, with the pandemic, it has dropped significantly low, but we're gradually picking back up. To go on with that, you know, we just want to make sure the public knows that we are trying to stay safe. We got all the PPE, and our drivers are doing what they can to keep the buses sanitized and all that. Okay. So if anybody, you know, our reservations department is open from 8 a.m. to 4:30 p.m. Monday through Friday, and 8 to 1 on Saturdays. If anybody wants to give us a call and schedule us a ride, we're at ridertec.org.
So one of the things that happens is people who don't know transportation, they have an idea about what's missing in the transportation world, obviously, and people who are in transportation have a different perspective. So could each of you tell me in your service area what you see is the most important gap in service? That would be, can you, Lisa, would you be able to give us an idea about the biggest gap you're working with?
I think the biggest gap for us is most of our communities are very rural. Some of them here in Prairie County, it can take an hour or longer just to go one way. And it's hard to serve everybody that needs to be served or that wants to be served. I think the biggest gap is we just, we can't fully serve everybody that needs transportation or wants the type of transportation that we have.
Yeah. Is there a specific group that you think is really missing out?
I think to some extent, the elderly, most of them would be, I think they would be afraid to travel by themselves on public transportation, afraid that they may not get back home. You know, they're not used to doing that. And I think that's a roadblock for them. And I know in my community, my little community, I'm surrounded by neighbors that they can't, I mean, they struggle getting to the grocery store or to the doctor because they're not Medicaid eligible.
Mhm.
And it's frustrating to see that and not be able to help.
Yep. No, thank you very much, Lisa. I think that everyone who does transportation really resonates with what you're saying. Joyce, do you want to describe the biggest gap that you deal with?
Well, I agree with Lisa. We're not about an hour from LKLP, their transportation facilities. On the elderly, you know, we do allow an escort. We do allow someone to go with the person, whether they're young, old, middle-aged. We do allow someone to go with them, especially shopping. We have the Dollar Ride currently that where no matter where they live in the 5-county area, they can call the day before and they can go shopping the next day for $1. And we'll pick them up. We may have to travel 30, 40 miles one way, but we'll get them there for $1. And then when we pick them back up from shopping, they pay another $1. So it's $1 a ride. So $2 for maybe 60, 70 miles round trip's not bad. And we're very blessed to be able to provide that. Housing, to me, people will call and schedule daily, and we may go out then, you know, and pick them up on their scheduled day, and they may not be there. They may have moved in another county, and they failed to call us and tell us. A lot of people, and it's really sad, they can't really give you directions as to where they live. So it's very difficult at times to, you know, to make sure where these, the clients are that we're picking up, try to pick them up in a timely manner, but a lot of times we can't find them.
Wow. I think that I hear what you're saying, and I think that the issue is really having the resources and being able to take the time and have that ability to reach out to people and connect.
It is. We have a lot of homeless people that live perhaps under bridges or in tents, and we have to go. They can call us and they'll give us a designated area that we can pick them up. And like if it's a grocery store or if it's you know, the bridge down the road, and that's where we go to pick them up. It's really sad, but we do get them.
Yeah. Well, thank you, Joyce. And Mona, would you like to tell us what you see as the biggest gap in the services that you provide?
One of the biggest gaps is a lot of the folks don't understand that the service is available. And like Joyce said, they don't have financial means. They don't even have a phone a lot of times. And we're going out there and we're waiting for them or searching for them. They're on our schedule, especially the Medicaid trips. We make a lot of trips to folks' homes and they're not there, and we leave a no-show tag. We have a lot of those issues. But again, the 5 counties that we do service in, our poverty level is like 33% out of 52,000 is the estimated population. And, you know, I just think understanding the service and knowing it's there and it's affordable. One of the things we do, we make our fares really affordable. It's $6 within our city limits and $8 within our county limits for a round trip. And we try to make that as affordable as possible because we know how hard everyone struggles with their finances. And again, just understanding, you know, what services are there and how to arrange that trip.
Yeah, super. And finally, Michael, you want to just give us a little information about what's going on in the gaps in your program?
Well, I would have to agree with Joyce, Mona, and Lisa about, our biggest thing is, like I said, is no shows and all that. We know they need their medical appointments and all this, and it's just sad. We go there and again, we can't find them. They say, well, I ain't gonna go today or whatever, for whatever reason, but we know they need their medical appointments, It's just sad. I don't know what we can do to help them out, but we're working on it.
Right on. I appreciate you guys all coming to this meeting today and sharing about your transportation program, because sometimes people think just because you're there that you can do XYZ thing, and you try to. And I think what this coordination does is it doesn't necessarily add more money into a problem, but it helps you target the resources you have. And potentially with transit, there sometimes are opportunities for more people to fit on a vehicle if the people know the vehicle is there. So when we get into talking about opportunities in our breakout groups, I hope that the transportation people and what they've told us all about what they're doing helps helps us all understand what kind of partners they can be, because they do really care and give to their communities. Carrie?
Thanks, Robin. So all of the links to all of those transit agencies' websites are in the workshop packet that I dropped into the chat earlier, and that we'll also be sharing with all of the attendees by email after the workshop today. We are going to skip ahead in the agenda to the breakout group discussions. We had originally planned for David Kack and Carolyn Klausler to share some information about rural mobility innovations, and we're going to share that with you at another time. The packet that I shared earlier has several pages in that PDF that are dedicated to some short case blurbs about examples related to active transportation, vehicle-based transportation, and technology solutions that are in use in rural areas or small metro areas around the country. And you are welcome to contact Carolyn about the research that she did about that if you want to know some more about that. So we'll move ahead into the breakout groups. We're going to split into 3 groups: active transportation, which will be facilitated by Jessica Blankenship; vehicle-based transportation, which will be facilitated by Eunice Holland; and technology solutions, which will be facilitated by Joe Jacobs. So you can choose which of these breakout groups you are interested in. Nellie, if you can go ahead and allow that to happen. Active transportation includes walking and bicycling. Vehicle-based transportation would be things like transit, as well as car share and ride share, while technology solutions may be apps or one call, one click websites or other kinds of approaches. We'll see you back together on the other side of the breakouts. Looks like we are all coming back together as those breakout groups end. So I want to invite Jessica and Eunice and Joe to give a couple of highlights about the conversation that happened in your breakout room. And for the rest of our attendees, you can choose the raise hand icon if you want to say something aloud, or type into the chat if you want to share something that was really interesting or exciting that you think your organization would like to work on.
All right, well, I'll start since I was in the first session. We talked about the different modes of transportation, bicycle, pedestrian, as well as different aspects. A couple of things that we learned was the bike sharing program. One of the participants was talking about a bicycle library where people could check out, like you check out a book, but you would check out a bicycle to use. We are also learning that people that's needing services, they may not be able to afford a vehicle, so they're bicycling, they are walking. The city of Corbin, I just recently completed their bicycle and pedestrian master plan, and so we'll put a link to it. Carrie can, I'll send that to you all. But one of the things that we have also learned for transportation users is a lot of people may not even have a driver's license. Maybe they lost it with a DUI. And so they're utilizing what they can use. Some of the current existing transportation and potential is sidewalks, new facilities, and I mentioned about the bike share program. Clay County, we are working on a multi-use path from the downtown area over to the hospital and behind. And then a few communities, we're not seeing it in rural Kentucky, or at least in my area, the e-scooters, but you're seeing those in larger communities. We talked about the funding, information, other support needed. Of course, several of the health departments are being a matching source. The Kentucky State Health Department is providing $10,000 per county for, and it's not all of our counties, it's a select group of them, that the ads are doing bicycle and pedestrian plans. So we can do the, be able to identify issues and as well as what they need to do in order for funding, as well as multi-use trails. Someone mentioned about they could get matching funds if they lay the fiber to increase broadband access, and then you put the multi-use trail or sidewalk on top of it. Our community action agencies are a hub for services, so they may be there for one issue, but they can be referred for transportation issues. And then we talked about marketing of transportation, social media, websites, word of mouth, flyers, utilize an email list, and also one of our participants have mentioned that they've got a resource guide, and I have even added it to our chat, a link to Operation Unite. They've got quite a few resources, but one of our local health departments also has a resource guide that we'll send out to everybody, that for those that are in re-entry, they're getting out of jail and they want to make good in their life, I guess you can say. So I'll quit rambling on and I'll let Eunice talk.
Yes, in our breakout session, we had the vehicle-based solutions, and there were 9 of us in the breakout, and we had Whitley County Health Department, and we had a couple of community action councils. We had Sandy Valley and then also LKLP, who we were talking about the mobility solutions that we have in the areas. And there are some areas with transit, with taxi. A lot of transportation that is being utilized is carpooling, friends giving friends a ride. The regional and like an inner city bus, LKLP talked about how they had experimenting with that and provided that service in their largest city, which is Hazard. And it did not get used very well. They only had about 80 people use it within 90 days. So the need for that was not like in the city. The need is mostly in the rural area. Sandy Valley talked about how they provide that inner city, and theirs is very successful. They provide a lot of trips to some of the larger cities in the area, Lexington and Louisville and Cincinnati and other areas. Provide trips mostly, to the airports, to bus stations. Some of the challenges that they face is availability. A lot of those, you schedule a ride, you schedule within a period of 48 to 72 hours. A lot of the riders, they want to have pretty much immediate response as far as they need the service that day. So a lot of them don't get scheduled because they kind of do it on a planned basis. They have passed out vouchers before and some users have not used them. We also talked about how their services are being advertised or to inform the public. Both of them utilize social media and their websites. Sandy Valley talked about how they had utilized billboards, had paid for. So we talked about that a little bit, and I'll be quiet so that Joe has a few seconds to talk for the last session.
Thank you, Eunice. My session focused on technology solutions to the transportation issues that we identified. We talked a lot about the potential for app development to address some of those concerns that came up. We talked about specifically our homeless communities and the fact that a lot of our providers have noticed that even though someone is homeless, that does not necessarily mean that they do not have access to this technology. So the development of an app that would help with scheduling rides and being aware of resources would be extremely helpful. And we actually jumped off of that and started talking about first steps for how we would get some major players together to work on that app development. So hopefully that this conversation has spurred some action as we move on. We also talked about the need for providers, especially, as well as the community, to know what resources are available. And those of us that have resource guides, we talked about updating those resource guides and making sure that all of those potential resources and things that are available in our community, that everyone around is aware of them and that we're able to make referrals appropriately when we need to. We also talked about efforts to market existing services throughout the region. And we talked about, we were not aware necessarily among the three regions about the ability for our service providers to schedule trips online, and whether that would be something that needed to be developed or if we just need to be making people more aware of that. But all in all, a very, very robust discussion, lots of good ideas that we're looking forward to coming up with an implementation plan for.
That's great. That's why we do breakout groups, so we can hear about ideas and get excited about them. David's got a question here. Is 211 active in Kentucky? Is there a 211 information service you guys know of? No, maybe not. Okay, that might be an opportunity.
Hey, Carrie, I think if I'm not mistaken, up in Lexington and maybe Louisville, they'll have a special dedicated telephone number that someone can call to get resources. But in rural Kentucky, I haven't heard of anything.
Okay, so
that's a good question.
Not statewide.
Yeah.
Okay. Well, it is 3 o'clock right now. So thank you again to all of our speakers and facilitators and to all of you for attending. We'll be sure to share all of the presentation materials, all the links to additional information with you, as well as the meeting packet that we put into the chat earlier today. A few minutes ago, Nellie put in registration for the next workshop that's occurring on December 1st on the topic of supporting recovery and economic resilience, as well as a link to complete an evaluation survey. Please do complete that. That'll help us plan for not just this next one occurring on December 1st, but we have some plans to do some additional workshops in 2021. So your feedback will help with that as well. So thank you all again, and please stay safe. Take care.
See you, everyone.
Thank you.
Hey, this is Jessica at the Cumberland Valley Ad. I have to say it's very pleasing and surprising to get to see so many of my friends here in Kentucky on the call. So thank you all.